COVID daylighted a lot of known and existing problems in Whatcom County, statewide and nationally. Some of those were the existing challenges with availability of behavioral health providers. Additionally, issues with affordable housing and homelessness came to full light during COVID. We also were exposed to just the huge challenges with childcare. Our business community worked really closely with our providers and with county government to address some of those issues, but we all knew that they were stopgaps.
In Whatcom County, only 1 in 2 children show up kindergarten ready to learn. And at the same time, if the child is a child of color or from a low-income family, only 1 in 4 of those children shows up to kindergarten ready to learn. We need to address that. We need to understand the roots of those disparities. Something that's really striking about COVID-19 for the BIPOC community is that it continued to highlight ongoing disparities. There's a massive amount of disparities in our systems, and we see that in just something as simple as access to education. COVID highlighted the necessity of having equal access to technologies, equal access to the internet for our students in order to see them thrive and succeed. That's true of our more rural areas as well as on our local reservations. And even before the pandemic, we have had a housing crisis in Whatcom County. We already didn't have enough places for people to live, and then on top of that, most of the people living here were spending more than 1/3 of their income on their rent. And then people lost their jobs, but rent didn't change. There was an eviction moratorium so we could stay in our homes, but rent didn't change. If we look at that, and then we look at who is most impacted by that, we're going to come back to our BIPOC community. And this is a bigger conversation about generational wealth, about the wealth gap for BIPOC communities, about the long-term housing policies that impacted whether or not our BIPOC community members could own property in Whatcom County.
These issues are all impacting us. Indirectly, directly, we're all facing challenges associated with behavioral health and childcare and affordable housing. It's everywhere. And I think what I feel hopeful about with the health department's COVID community health impact assessment, I think it allows us the opportunity to galvanize support, to say, this matters. We're going to work on these issues together. Let's have an impact and let's create a healthier society and environment for all of us.